Hey guys, in this video I want to share with you just some information on what's behind plaquing in the arteries, okay? So there's just a massive amount of confusion that's out there in relationship to the sequence of events that occur, the exact cause and effect relationship. Somehow so-called science doesn't want to be too positive and really say this causes this. Everything is associated, there's risk factors, and it puts the patient in a massive confusion. So let's just take a look at some of the pieces of the puzzle, and then we can rearrange them in a correct sequence of events. Amyloid plaquing, that's actually one of the things that messes up your neurons in the brain. Parkinson's, Alzheimer's, so you have plaquing in the brain. And then you have also plaquing in the arteries. You can have amyloid plaquing in the liver and the kidney, and even in the pancreas that can actually shut down the cells that make insulin and cause diabetes type 1, okay? Even make it type 2 as well. You can have this plaquing in the joints as rheumatoid arthritis. So if you think about it, you have the brain, you have the arteries, you have the gums as gingivitis and all that plaquing. You have in the joints you have inflammation, you have plaquing, you have all sorts of scar tissue in there. So there's an interesting phenomena that's occurring in different parts of the body. Okay, so when you go to the doctor, they might test for amyloid plaquing, and there's a medication for that. They might find that you have intracellular calcium or calcium plaquing, so that's why then you get high blood pressure, and that's why you have calcium channel blockers for that. Or you might have high cholesterol, so we put you on a statin. Or you might have high insulin, and we can put you on diabetic medication. Or bacteria shows up, and they put you on some type of antibiotic. Or high levels of white blood cell, and they put you on a cortisone shot, right? So you have all these different things that occur. So my thought is, let's take a look at this and what would happen as a chain reaction, first, second, third, and fourth, okay? Here's what I think that's happening. Number one, you don't start off with high cholesterol. You start off with high insulin, okay? When you have high insulin, it makes the cells in the vascular system, the little cells that compose what's called endothelium, it creates a leak in those cells. Okay, very similar to leaky gut, where you have another set of inflammation and scar tissue and the whole thing. I didn't even talk about that. So you have this little leaking through the artery wall, and boom, you're going to actually stir up a hornet's nest with the immune system. Okay? So if you start off with high insulin, and it could be other things too. You could have very low vitamin C, which almost like a borderline scurvy, and create the same like ulcers or a lesion in the artery wall as well. So we could have a vitamin C deficiency. Let's say you're just a junk food junkie. That's going to create it too. A lot of stress in the vascular system, or you're an alcoholic. All these things, nutritional deficiencies, chemicals, can start this reaction. But the second thing you get is artery damage. Okay, so we have artery damage, and it could be damage in the joints and the liver and the brain, depending on your weakest link in your body. So after you get this artery damage, then guess what's going to happen? You're more susceptible to bacteria at that point. Okay, now they've even found the same microbes in gingivitis in your gums, in your arteries. Okay. So that's an interesting coincidence. So I'm wondering what other part of the body it affects too. And then you'll get an immune reaction, that's number 4. So inflammation is not really the cause of these things, it's the effect. Okay, that's what you need to straighten out. And then what happens, here comes the cholesterol. The cholesterol acts as a band-aid to come in there. So there's 2 types of cholesterol. There's 2 types of LDL, which is so-called bad cholesterol. And I did a video on this. I'll put all these links down below. You have type A and type B. Type A is the big, fluffy, type of cholesterol that it's not involved in trying to do anything with this artery wall. Type B is very small and dense, and those are the guys that are always involved in trying to heal this lesion in the wall. Okay, so how do you know if you have type A or type B? Because they're usually combined, you can't tell. You look at your triglycerides. If your triglycerides are high and your HDL is low or possibly normal, then you have more B. That means that there's something going on, there's some type of healing going on, there's some type of something going on in your body that you need to address, okay? So this is not the villain. This is the thing that comes in as a chain reaction to help try to put a Band-Aid and try to heal this thing, okay? Because cholesterol is there to actually help heal certain things. So we don't want to completely lower this. We want to understand what's happening. So we have this cholesterol, then comes the amyloid plaquing, okay? Or other types of fibrous tissue. This is all protein. It's like it's a part of the Band-Aid. You're going to start getting stiffening of the arteries if there's too much of this. Then we get the calcium. Calcium starts building up. So we have this whole mesh of this Band-Aid that's made from protein, calcium, and cholesterol that's all trying to heal this area. That's what your body's trying to do. So for someone to come in there and start treating these without understanding it is just completely, utterly insane. So I just wanted to kind of show you the sequence of events. Step 1, 2, 3, 4, 5, 6, 7. That's really the order of things that occur. And it's happening all over your body. So, and I'll put a link down below of what you need to do for this culprit right here, because this is a big one. And this actually will cause high blood pressure and obesity. But obesity is the last thing to occur, not the first. Thanks for watching. Press it. Forget it, I'm done. Press the subscribe button and I will keep you updated on the future events.